So, Doctor, I guess curious to hear maybe a little bit more about this blue. I know we didn't talk much about it, but this blue light product for bladder cancer or bladder tumor resection. So, how does that work, and why is it better than using monopolar bipolar?
What about monopolar bipolar?
Yeah, well, what is attractive about blue light versus any other
Yeah, so blue light is not. Yeah, blue light's not in. It's not a treatment, but it's a diagnostic tool. So, a patient who it shouldn't be used for everybody, but it should be used for certain patients with bladder cancer. And like I said, it's a marker that is placed in the bladder an hour before the procedure with a catheter, and then it ideally will help. It gets picked up by areas that are more malignant. So it can help you normally under white light, an area may look normal. With blue light, you may pick up an area that has a different look to it, sort of a brighter look to it that you would be able to identify in biopsy. So it should help target areas in the bladder that you wouldn't normally see with white light. And so I use it for patients with bladder cancer who maybe I've done like a screening urine test, like a cytology, which shows malignant cells, but I do a cystoscopy in the office and the bladder looks normal. Or they may have a history of bladder cancer and I looked in the bladder and it looked normal, but the cytology came back positive, or they were having blood in the urine or something else. So it's a diagnostic tool, and I use it pretty selectively, but it is becoming more popular.
Got it. Okay, that makes sense. Cool. And Doctor, can you, if you think about these different companies that you've interacted with, so Boston Scientific, Olympus, Storz, Cook, Bard, who do you have, what's your impression of kind of who is the most innovative, who is the least innovative? If you had to compare and contrast them based on, how often they're kind of coming out with new products, how would you think about that?
I don't know. I mean, I think, they all have their strengths and weaknesses. I mean, I think that as a product line, I think the quality of Cook's products have always been really good. It just seems like it's good quality. Boston Scientific, to me, sometimes feels a little cheap. It doesn't have the same kind of, feel to it that, some of the other ones have.
What do you mean by feel like?
It's hard to describe. The way the stents feel sort of seem like they're, a little cheap. I don't know what it is. It just, it's hard to put words on it. It just doesn't feel like the same quality.
Okay, got it. And then Cook, the high quality for Cook, is that, are you talking just about stents or you're talking in general?
In general, their baskets are solid. I mean, when I see a Cook package, I think it's going to be pretty good.
Okay, got it. And then BSC, how do you feel about Boston outside of the stents?
About Boston what?
About Boston Scientific for other products besides the stents. So,
catheters. Yeah, I think they're okay. Like I used an Access, like a dual lumen Access thing today from Boston Scientific, and I thought it was good. I mean, I didn't have a problem with it. So sometimes just getting used to like a different color or a slightly different feel. You use something for 10 years or 5 years, whatever, it just, that's what you get used to. But just because something is gray instead of blue doesn't mean that it's not just as good. So, I can't say anything was bad that I used today. I mean, I did a stone case, I did a bladder tumor. I mean, Boston Scientific provided most of the disposables except for the basket, I think.
Got it. Okay. So sorry, Doctor, I interrupted you on the innovation point, where we were talking about innovation. You basically said your kind of perception is that they're sort of all the same. So you don't see any difference? I mean, I noticed that sort of you talked a lot about kind of Storz, and then the blue light, and then the bipolar device. Do you have a perception that Storz is any more innovative than anyone else, or?
Not really. I mean, I think that generally when I think Storz, I think of scopes, and I think that no one else has really taken over that market.